Absolutely. So I just wrote down a few things: range of motion, stability, function, right? These are great things to work toward. Would you say that strength training is an important aspect as we get older, or is that something we shouldn't be doing as we get older?
So that's funny you ask that because it doesn't matter how old our patients are when they come in. So I have NFL patients, I have Medicare patients. They all do the same screen when they come in just so I can see how they move. So I tell my Medicare patients, I want to see you squat. And a lot of them will say, "Oh, I can't squat. I have bad knees." And I'll say, "Well, when you came in, you sat down in that chair, which means you squatted. You got out of the chair, which means you unsquatted. So you can squat." So as we get older, we get these messages that things are bad for us. Motion is not bad for you. Deadlifting is not bad for you. Squatting is not bad for you. Going up and down stairs is not bad for you unless you cannot do it. And if you don't do those things, then you eventually can't do them anymore. So the purpose of what we are doing when we're screening people is to part of that is to let you understand that it is safe to do these things. And the more you do these things, the healthier you stay. So we actually 3 weeks ago stopped being participating providers with Medicare because Medicare will not let us see patients for either maintenance or preventative.
Hmm.
So I've been doing sick care with Medicare patients for 20 years. I have to wait for them to have an injury or to have a
Hmm.
surgery to work with them. Now we see Medicare patients when they don't have any complaints. They come in once a month. We make sure things are firing. We go over their exercises so they know in the next 4 weeks this is what I'm doing to maintain my strength, my balance, decrease falls, all that kind of stuff. So I would much rather work with people and prevent them from needing to see a physical therapist. And so that's kind of like why we changed our model. And that's our message to Medicare patients. You should be doing everything else, everything that everybody else is doing. You have the ability to do that. We just have to teach you how to do it.
It's awesome. I love that. A couple things you said there that I find very interesting. Number one is we teach ourselves certain things, right? We tell ourselves certain things, and what we tell ourselves becomes the truth.
Yep.
And if we tell ourselves that I can't do this, then you can't.
Right.
But you just proved a point that when someone comes in and says, "Well, I can't do a squat," you're like, "Well, you sat down in my chair, so clearly you can, but you've told yourself that you can't or you shouldn't or whatever the story is." And the other part that I think is fascinating is, and I've said this for years, that I don't think we have a great medical system in our country. We have an incredible insurance system. And many people, well, in general, I personally believe our society as a whole is very reactive and not very proactive. But in your practice, I know that the exercises that you teach and that you help people learn and can do on their own to be proactive, to avoid injury, right? And that's part of what the system and the technique is all about. So with that, I know that balance and fall preventions are obviously hot topics in aging today. You may even mention them, but what can people do daily to improve their stability and reduce fall risk?
So what we preach with all of our patients, including Medicare, is that we're giving you exercises. So what we teach our patients and what I teach the clinicians that I work with that are around the world on how to do this is there's a three-step process. So first we have to get your muscles to contract. So if
Okay.
your muscles are not getting the communication from your nervous system to say contract, we can't strengthen them. We can't make them work well enough to stabilize you. So the first thing we have to do is turn the muscles on. So that's what we're doing with our patented system. First, we turn the muscles on. We give you exercises that help you maintain keeping the muscles on. Once you come back and the muscles are on and you've maintained that, then we say, okay, fantastic. Now we have to work on endurance. Because if we've turned muscles on that haven't been doing much for 6 months, they're going to get tired really fast. So you going on a 2 mile hike might be enough to fatigue them, and then we're back to turning them back on. So once we get endurance, then we can finally work on strength. So that's when we can do squats and walking up and down stairs, step ups, deadlifts, that kind of stuff. So that's kind of the progression. So we start with get the muscles to work. Then we help you get endurance so they don't fatigue as the day goes on, because most people as they age figure out that, it's later in the afternoon that my knee swells, my feet hurt, my back is tight. So we got to get you, that's just your body saying, I had the ability to do this in the morning. I just lost the ability halfway through the day because I don't have the endurance to do that. So once we can get you to the end of the day without having those symptoms, then we can give you strengthening things. And all of the things that we give you, the key is you have to be able to do them quickly and just about anywhere. So like some of the exercises that I gave you, you're sitting in a chair. Some of the exercises, you're standing up and you need like 5 feet of room around you. So the things that we give people are really easy, and they understand if I start to feel tight in my back, that doesn't mean stretch out my back. That means sit down on the chair and do my chair crunch, because the tightness in my back, we've figured out, is the red flag for my abs not doing what they're supposed to be doing. So it's really nice that we can give people like little self checks. You don't have to come running into me every time something happens. I give you the thought process that if you feel something on this side, do the exercise for the thing on this side. And most people will come in and say, hey, I tried that thing and it worked like a charm.
Yeah, absolutely. And I can attest to that. And you mentioned red flags. What are some red flags that people might need to either come see you or seek professional guidance, or adjust their routine in some way?
So the biggest thing that people do across the span is something hurts. They either cover up the symptoms with something: ice, heat, stretching, foam rolling, little massage guns. So something hurts, something feels tight, attack that spot. So that would be red flag number one. Or something hurts, I stop doing things. Red flag number two. So if you're finding that you're doing less because you have fatigue or tightness or pain, that means it's already happening. The snowball is already going. Okay. And then if you feel like, well, if my back gets tight, so I roll it out, or I use a little massage gun, or, my feet hurt, so I put these inserts in, all you're doing is what I did my first year of PT school, is just covering up short-term symptoms.
Sure.
So when you do that, not only did you not fix the problem, so the original problem's still there, causing problems. Now you've taken away the symptoms, so you feel like you can do more. So now you're actually speeding up the snowball rolling and getting worse and getting worse. So the red flag is anytime you feel like you're stopping doing something, you have to adjust what you're doing, like less range of motion, less steps, whatever, or you have pain that you're covering up with some type of symptom modification gimmick. And the definition of a symptom modification gimmick is if you have pain at a spot and you're doing something to that spot, that is a symptom modification gimmick. Because 99% of the time when people come in with low back pain, we never touch their low back. Low back pain is just a red flag of something going on somewhere that a medical professional needs to figure out for you. So those are your red flags. If you are 65 years old and you go play 18 holes in the morning and then you go paint the fence in the afternoon and you've got no pain and no tightness and no problems, fantastic. You are cruising. If you feel like you have to put your inserts in to play golf, and then you have to do your stretches after you play golf, and then your shoulder hurts after you paint the fence, so you put ice on it, you got a lot of stuff going on. It's time to go see somebody.